United Healthcare CEO, big shot. I don't know if any news is broken about the motives in the last hour or so, but
we don't know who the shooter is, so we have no idea what his motive is.
So without knowing, it's pretty clear and pretty obvious without knowing. And even if it's not clear or obvious and it turns out to be something else in this case, it's pretty clear and obvious that because of Republican ethos, because of right-wing conservative ethos of letting companies steal from us and promoting rage and promoting gun culture, someone decided to take, matters into their own hands because United Health. Now, that's not clear yet in this particular case, but that would be that's a pretty easy assumption. And even if it turns out not to be the case, it's a through line, between Trumpists, Elon Muskists, destroying our culture.
Yeah, the bottom line, Brian, is it's a great opportunity to talk about a great opportunity. That sounds like I'm cheerleading for somebody's death. I'm not, but it presents an opportunity to the news media to talk about Medicare Advantage and the practices of big insurance, but they're not going to take that opportunity. Sadly, until or if we learn what this guy's motive was. I mean, it's possible that the CEO of United Healthcare had an affair with this guy's wife. I mean, we just don't know, right? We just don't know.
It's possible, but it doesn't matter entirely. I mean, it matters for that particular case, but the through lines of the connection that people are drawing, whether they're true or not, are not untrue. Like, even if, okay, this guy, it was an affair. Still, the through lines of the people getting screwed by billionaires, by CEOs, by healthcare, getting culture promoted.
There's a whole thread over on Democratic Underground basically speculating, is this the Bulls uprising? And I don't want to go there. I don't think that's healthy, and I don't think this is that. I think we're away from that, frankly. But Brian, thank you for the call. I appreciate it.
I don't know if you have heard that the United Healthcare CEO was shot and killed this morning.
Yeah, I did.
Yeah.
Yes. Okay. Well, I don't think this was random. In my opinion, this is a result of activities, the decisions made by United Healthcare. Our state has had, as a retired state employee, they've had us on United Healthcare for a couple of years. And when I received paperwork from United Healthcare that so far my healthcare has, my providers, the hospitals, the clinics, the doctors, have submitted $6,800, and they've paid a total of $1,800. And this is Advantage Medicare. And what did they get, Tom, last year? $149 billion? Isn't that what you reported in January?
Like I don't remember.
Yeah. Okay. And so you have a CEO shut down on the street, and I'm hoping that this is not a continuous pattern of people who they've watched someone die because they're denied. My chiropractor was denied the last time I went. The only payment they received was a $15 copay out of my pocket. Yeah. And that, this is.
So your question, Norma, for Congressman Pocan?
When can we have expanded Medicare? Please, y'all do what you can and see if you can't get some kind of control over these companies that are not paying the doctors, the clinics, and the hospitals. It's all going into their pockets. This is Reagan's doing, changing the law.
Let's let him answer the question because we only have 20 seconds.
Yeah, I mean, Norma, the real problem is just the way Medicare Advantage works. You have to get prior authorization for care. They deny millions of claims a year. Over 80%, I forgot the exact number now, over 80% of them get turned over in appeal. It shows that they're just trying to nickel and dime, but that means your life is at risk and your illness can continue, especially at a vulnerable point in your life. So people should just be aware of that. I think this is the end of that open enrollment period where people sign up, Tom. It's good to remind people.
Yeah, absolutely. I need to write another op-ed about Medicare Advantage. It's been a while. Thank you. 51 minutes past the hour. Congressman Mark Pocan is with us for the hour, taking your calls. We'll be right back on the other side of this break with Congressman Pocan answering your questions. Stick around.